First Alzheimer's drug to slow disease progression gets full FDA approval, triggering broader Medicare coverage. CNN, the US Food and Drug Administration on Thursday granted transitional full approval to the Alzheimer's drug Lemcambi, the first medicine proven to slow the course of the memory-robbing disease. The Centers for Medicare and Medicaid Services said Thursday that it will now expand the coverage of the drug, broadening access for up to the estimated million people with early forms of the disease. Today's action is first a verification that the drug targeting the underlying disease process of Alzheimer's disease has shown clinical benefit in this devastating disease. Teresa Braccio, acting director of the Office of Neuroscience in the FDA's Center for Drug Evaluation and Research, said in an announcement. This confirmatory study verified that it is safe and effective treatment for patients with Alzheimer's disease. Leqembi from drug makers Eisai and Biogen received their accelerated approval in January based on evidence that it clears the amyloid plaque buildups in the brain that is associated with Alzheimer's disease. But because of the earlier coverage decision by CMS, which provides insurance coverage for many elderly people with Alzheimer's through Medicare, the drug hasn't been widely used. It costs $26,500 annually before insurance coverage. You had this treatment at your fingertips, and suddenly you had Medicare saying, "Yeah, but you can't quite get access to that yet," said Joe Montmini, 59, who was diagnosed with younger onset Alzheimer's in his early 50s. Getting that insurance coverage is incredibly significant because having a treatment is awesome, but it can't afford to pay the $26,000 cost. The beginning of a new era. The drug was approved only for people with early forms of Alzheimer's disease, those with mild cognitive impairment or mild dementia who have been confirmed to have amyloid plaques in their brain. Dr. Lawrence Honig, a professor of neurology at Columbia University Irving Medical Center, estimates that the group consisted of about a sixth of the more than 6 million Americans currently diagnosed with Alzheimer's. People with more advanced forms of the disease may not benefit from the drug use, he said, and may face increased safety risk. It's not that it's not good for people who moderate or severe disease. It's just that we don't know, said Honig, who has consulted for drug companies working on Alzheimer's medicines. Even for those who may benefit from the drug, Honig noted it's not a cure. Leqembi was shown in an 18-month clinical trial to show slow declines in cognitive ability and function by 27%. The treatment we have right now are just the beginning of the new era, Honig said. We hope that we will have treatments that are more efficacious. The Alzheimer's Association said in a statement Thursday that it welcomes the FDA's full approval. This treatment, while not a cure, can give people in the early stage of Alzheimer's more time to maintain their independence and do the things they love, said Dr. Joy Pike, the group's president and the CEO. This gives the people more months of recognizing their spouse, children, and grandchildren. They also means more time for a person to drive safely accurately and promptly take care of family finances and participate fully in hobbies and interests. However, the drug also comes with a side effect and requires monitoring through regular brain imaging. About 13% of participants in the trial experienced brain swelling or bleeding, and those risks could be higher for certain groups based on their genetics or if they take blood thinning medications. The FDA says the boxed warning is included in the prescribing information to alert patients and caregivers to the potential risk associated with these side effects. Health systems have been gearing up for broader use of the medicine. It's complicated, and because of all these complications, we have been trying to be very thoughtful and taking our time and preparing the system for this, said Dr. Greg Georges Nassan, medical director of the Division of Behavioral Neurology and Neuropsychology at Mount Sinai. The drug is given as the IV infusion once every 2 weeks. Infusion centers have been preparing for the potential surge of new patients. In certain areas, I anticipate we will receive probably 15% to 20% more patient referrals for this drug, said Sue Lutura, Chief Operating Officer of Vivo Infusion, which says it provides infusion services for about 50,000 patients in the US. We know in clinics in Florida that we may have to increase the capacity at those clinics, and that may involve increasing the number of days, increasing hours, or offering weekend hours. Drug maker ASI said it doesn't expect that everyone estimated to have early Alzheimer's disease will seek to use the medicine right away. We are going to have a much lower number, at least at this moment, ASI US CEO Ivan Chong said. Maybe a few years down the road, as these therapeutic options are available, these testings are reimbursed, that number will go up more. Don't, but I don't think we're going to see 1 million people in the next couple of years. Montemini is waiting to see if he qualifies for the drug based on the brain imaging for each. ASI said it also expects the CMS decision on coverage soon. If he is, he won't hesitate to take it for the chance to have more time with his wife and 2 sons, who he says are in their late 20s and are early in their careers. They will often call me and ask me for advice about work, and I enjoy those phone calls. But I worry that sometime soon I might not able to help them. Montemini said, like any parent, I would love to see them actually get married and have a family. Basically, I just want to experience many of the activities that most people take for granted. Expanded Medicare coverage. CMS said that this year that it would provide broader coverage for Liquimbi if the drug received the traditional FDA approval. CMS today affirms our commitment to help people with Alzheimer's disease gain timely access to innovative treatment that may lead to improved care and better outcomes. Administrator Chiquita Brooks Lashaw said in a statement Thursday, with the FDA's decision, CMS will cover this medication broadly while continuing to gather data that will help us understand how the drug works. This is welcome news for the millions of people in this country and their families who are affected by this debilitating disease. Medicare recipient will probably face out of pocket cost for Rikimbi. Those in traditional Medicare will be responsible for the 20% coinsurance of the Medicare approved amount after they meet their Part B deductible. How much those enrolled in Medicare Advantage or supplementary plans will will vary based on their policy. The coverage will comes with some qualifications. Medicare will cover the approved drugs when the physician and clinical team participate in the collection of evidence about how these drugs works in the real world, as known as the registry. CMS said this information will help gauge the usefulness of the medications for people with Medicare. Providers will be able to submit the evidence through the CMS facilitated portal, which will be free to use. CMS released the more details of its plan to cover new Alzheimer's drugs in late June. It said it is working with a number of organizations that are preparing to open their own registries. Clinicians Clinicians will be able to choose which registry to participate in. The agency is looking for data to help answer several questions outlined in its national coverage determination released in April. They include does the drug meaningfully improve health outcomes, such as slowing the decline of cognition and function for patients in broad community practice? Do benefits and harms, such as brain hemorrhage and edema, of using the drug depend on the characteristics of patient, providers, and the setting? And how do benefits and harms change over time? Patient groups and the pharmaceutical industry, however, will have voiced concerns about the use of the registry, saying it will create a barrier to treatment. Broad Medicare coverage of Leqembi and similar types of medications to slow the progression of Alzheimer's disease will probably have a big impact on the program's spending. If 10% of the estimated 6.7 million adults take Leqembi at an annual list price of $26,500, it would boost spending by $17.8 billion, according to the analysis by KFF, formerly the Kaiser Family Foundation. That would exceed the total spending on the top 10 Part B drugs administered in doctor's office in 2021. The increase in spending could lead to higher Medicare Plan B premiums for all enrollees.